We are really tailored to meet a very specific population, adolescents and young adults who are really struggling with primarily mood disorders.
Our mental health program is for anybody who is struggling with any sort of anxiety, depression, anything that kind of impacts their daily life.
It can present as ADHD. It can present as personality disorders, attachment issues.
A lot of times patients come in and they just are they feel hopeless. They feel scared.
Some folks with trauma, they suppress a lot of trauma or memories of trauma.
Working to create a safe space for our clients to be able to process their own trauma and validate their traumatic experiences is really important.
So Sandstone Care has 2 different tracks for our mental health that we run. We run our teens or adolescents, 13 to 18, and then we run programming also for mental health for young adults, which are 18 to 30.
So teens are so much different than young adults, just in the sense that their brains are not developed yet, right?
When we're teenagers, our worldview is our peers, and it's driven by our peers. And that positive reinforcement of being in the group or being liked or having a solid group of friends.
We really focus on the things that teens are worried about, that they're struggling with. We talk a lot about social media. We talk a lot about worrying, anxiety. We talk about perfection.
It's really important to have a specific young adult track, because when they come out of high school, some of them are going to college, some of them are starting their careers.
We're transitioning out of our parents' homes. We're making connections and learning how to build friendships and relationships outside of proximity.
Society says you become an adult overnight, and that's just not the way the world works. It's not how our brains work. It's not how we're wired to function. What's really important about Sandstone and the programming that we offer is that we really cater to the fact that you don't have to have all of this figured out. We really normalize the fact that you can still be struggling with day-to-day life skills because you just haven't learned them yet.
Another thing that makes Sandstone unique is we have the group, we have the individual, and we have the family components all within the same building.
The main reason that we're looking at multiple different aspects of treatment and programming as a whole is mainly to make sure that the client is able to express themselves in multiple different ways.
If they see that you're there to help them, if they see that you're genuine, that you're not treating like a robot or a number in the line, and you are in touch with humanity, they're going to appreciate that.
Group therapy is such a unique and beautiful part of programming at Sandstone Care, and we intentionally keep our groups small.
We find that clinically, a smaller group setting is going to give people the opportunity to be able to share and really get into in-depth, deep conversations during that group process.
And knowing and being able to look across the table or just around the room and know that you're not the only one going through some stuff.
Family is an important aspect in this. We provide multifamily group.
The family is able to talk about emotionally charged topics in a controlled environment so that the interactional patterns that usually exist that prevent those types of conversations are able to be had.
And so if we can teach parents, like, how do parents stay calm? How do parents emotion regulate? Then they can help kids to do the same thing.
I think a lot of times when people talk about the treatment team, it's the therapist, the psychiatrist, or the med provider, and that's great. But we forget that some of the most important pieces of that treatment team are the family and are the client.
Our academic vocational services build on increasing life skills, especially for our young adults, really helping them with areas where they might have been struggling.
They can explore what they want to do with their lives. Do they want to go to college? Maybe they want to look into trade school. Maybe they want to jump right into the workforce.
And for our teens who are still really working on the school aspect, we can talk about test anxiety. We can talk about social anxiety, going into a big class and having to give a presentation. Having the academic vocational coordinator allows our kids just one more opportunity to be successful outside of Sandstone.
In that vocational support, they're also learning life skills of how to be an adult and how to function without, parents or loved ones taking care of you.
We really believe in everybody's ability to grow and change.
We know how to treat an individual for what their needs are. We're not looking at just a mental health issue, but we're looking at a human and what a human's needs are.
It's okay to talk about things that are going wrong. It's okay to recognize you're not going to take life on by itself. Everybody has issues. If you want a friendly, non-judgmental environment, people who are going to show up every day and actually genuinely care, then we're here.